So why don't we go to a chiropractor? Going to the chiropractor means that you are working on the structure and the function of the whole body. The whole body needs to be controlled by the brain, and if the brain doesn't get the signals out to the rest of the body, then it's suffering. So a simple word that we often hear is dis-ease. If the brain doesn't have the ability to get a signal from the brain to say the heart has now got dis-ease. The spine should have 3 curves to it, 1, 2, and 3. And if one of these curves gets lost, then the body has to compensate, and it's taking some of its regular function and adapting for this function. What we're going to be looking for today on your x-ray is to see these curves. Which ones do you have, which ones do you not have? From the side, it should have those curves that we were just talking about. But if you lift up your hand for a second and you go like this, it's the same arc that you'll see in the arch of your foot. It's the arch that's in the pelvis, it's the arch that's on the spines. It's arch of a relaxed hand. It's its strongest arc in nature. We're seeing on bridges and everywhere else. So what we know is if we lose some of this, that lack of function gets added to something else. So that's why we take a full body x-ray as opposed to an x-ray of just the complaint, to see how does everything work. I know that when a spine is straight, it won't act like that. The one that you came in with isn't going to act like the one that you have right now as if it was straight. So my main goal is to do that. But what I'm taking is, I'm looking at your intake paperwork, the symptoms and the complaints that you have, and I'm going to compare those with the spine. The spine is a fuse panel to the rest of the body, and if all the pieces line up, it comes together like a zipper. If we take a rubber band and we put it on our arm like a tourniquet, if this is a nerve that comes out of my brain, out to the body, it could go to the liver, it could go to the arm, it could go to the sciatic nerve, whatever your complaint might be. But if I have pressure on it, is it healthy or sicker? A healthier nerve has no pressure on it, a sicker nerve has pressure on it. So this is what we're looking for, is how the bone's design is to protect the spinal cord, and if there is altered biomechanics, pinched nerves, altered function in any way, it's got that tourniquet on it, and that's what our goal is. Not to get rid of the pain out here. People come in and they'll tell me, hey, I have a hand problem. You don't have a hand problem, you have a hand symptom. The problem is what causes it. We're getting rid of this, okay? When you look at your x-rays today, we're going to compare it to a normal spine. There's one that will function within normal limits and it has very minimal complaints. Then we'll have one that's maybe like yours that's going to be outside of normal limits and has objective and predictable findings for the complaints that you do have. What's going to happen when we look at these two spines is I'm going to ask you, which one would you rather have? Obviously anybody would want the straight one. Think of your family too when we do this. Which spine would you rather your kids have? You want your kids to have the straight one or the crooked one? Obviously you want them to have the straight one, but what kind of things could you expect from a kid that has a crooked spine? Kids that have a loss of the curve in the neck, that have side-to-side scoliotic curves in their back, don't necessarily have time. Just like this tourniquet doesn't hurt right away. You give it some time and it's going to throb and ache. Kids that have a subluxation, misalignment in the spine, they're going to have altered sleep, they're going to have mood swings, they're going to have problems with concentrating, focusing, headaches. They'll have appetite up or down. It's a modulation thing that we're trying to figure out where are these wheels running out of balance at. One thing that makes us different than other chiropractors is that we do these objective findings. What objective means is that it's confirmable without hearing a subjective complaint. So you could say, I have a headache, and then we look at your x-ray and be like, you should have headaches with a neck like this. I have a sciatica. We look at your x-ray, back like this would look like sciatica. So an objective finding confirms the subjective complaints that a person comes in with. And so when we go over your films today, what do we want to find out? What I need to find out from you is, do you want to take the tourniquet off, or do you want me to loosen it? Do you want to put a band-aid on the complaint, or do you want to stitch it and make it back the way that it's supposed to be, function to its elite potential that we have? The disclaimer that everybody hears in this office is, if you don't want to fix it, I need to know, because that changes what we do. If you're not going to maintain something after you fix it, then there's no point in fixing it in the first place. So what happens when you do an adjustment? What is our ultimate goal? Somebody doesn't necessarily get less pain or anything, but they get improved function and motion. So when you turn the thermostat on your house, on your car, on the seat warmers in your car, or anywhere you want to be, does it go up right away? It's going up right away, but is it there right away? No, every process takes time. Instead of me wanting you to be not hurt, I want you to be more awesome. So the direction's the same way, the motives are different. So we want to make a person as good as they can get without having to use strong interventions like drugs and surgery and synthetic medication and stuff like that. The body knows how to do what it's doing, and sometimes it needs a catalyst, and that's what chiropractic ultimately is. Let me know if you want to fix this, or if you want to have more of loosening the tourniquet or band-aid care, and we can tailor it specifically for what you'd like to do today. What would happen if you didn't get adjusted? Well, that's probably what gets most people to the office. There's a couple things that are specific, or that are unique to everybody. Everybody's fighting time, everybody's fighting gravity, and then to add injury to insult, we have jobs, we have stress, we have workloads, we lift things funny, we do whatever, gardening, shoveling snow, car wrecks, all these different things that that bring us down even more than what time and gravity can do on its own. So what are we going to do about that? And one of the options is to do nothing about it, and as of right now, I guess we're here looking at it. So that's probably not our best option at this point, but that wear and tear is the same thing that makes us stain our deck outside in our house every couple of years. That's the same thing that makes us change the oil in our cars. That's what we get haircuts for. Go to the dentist, get cleanings, all these other things. See, the dentistry has been a kind of an interesting field because they've been able to explain the maintenance model better than probably any other profession, and everybody goes to the dentist every 6 months or so. Like, for example, let's say instead of straightening our spine, we want to straighten your teeth. You're going to get braces, you put braces on, you wear them 24/7 for a couple of years, and then they're finally straight. Chiropractic is far more powerful than that as far as timing goes, because we can take a spine that's maybe not been aligned for maybe 15, 20, even 30 years, and within 6 to 9 months, in a lot of cases, you can get a full restoration of the curve again. A lot of cases are less, and some take even a little bit more, but it depends on what we find today when we go over your film. If you're not going to fix your spine, if you choose to do more of a band-aid type of approach, if we're going to alter our treatment, we should alter our expectations. And so you can get out of pain with band-aid care, that's maybe the purpose, but you might re-injure it, just like maybe a scab or a scar on your hand. You're going to nail it, snag it on things from time to time. Your back might not be as resilient as it was if it was all the way corrected. So just understand the difference between corrective care and band-aid care, so that we can modify our expectations of what we should expect in the time frame and